So namaskar everyone and welcome back again to my channel, and today we are going to take one step ahead, and this is Thyroidinum part 2. In the last session we discussed about Thyroidinum and we saw different facets, different actions, different modes of prescription, basic understanding of Thyroidinum, how we can use this as an anti-miasmatic remedy, or how we can use it as a Sarcode basically. I know in my last lecture, many places I said Thyroidinum as a nosode, That was my mistake. Actually, I was not thinking about whether it is a Sarcode or a nosode. I was thinking Thyroidinum as a remedy. So whenever I talked about any Sarcode or nosode, I generally term it in a frame of anti-miasmatic remedy. So, pardon me for that. That was my mistake. It is not a nosode. Definitely, you know that it is a Sarcode. But to go ahead from there, let us try and understand whether it is a Sarcode, whether it is a no-sode. You need to understand the basic idea of the drug to prescribe. Now, many a times, a lot of people ask me, I have got this question many a times, and they ask me that, is there any indication to prescribe anti-miasmatic remedy? Because a lot of time people feel that it is all empirical prescription. Of course, when you see a history of thyroid in the family, you think of thyroidinum. You see history of a tubercular in the family, you think of tuberculinum. Cancer in the family, you think of carcinosin. Definitely, this is one of the key indicators. When you see in the family history, or you see in the genetics, or hereditary pattern is seen. Definitely, you have to think of those anti-miasmatic remedy. But what I have seen in my practice and I have understood is that that is one way of practice, but there's another way of practice where if you know the drug itself, like thyroidinum, tuberculinum, all the nosodes and the sarcodes, you know it properly. You know their materia medica. You know their pathophysiology. You know their cardinal symptoms. Then you can prescribe them even in a better form, maybe anti-miasmatic or maybe as a drug indication also. And this type of prescription definitely gives a very good results. Like you can really crack some of your cases. Many times we're always looking for constitutional remedies, but these remedies, the sarcodes and the nosodes that we're talking about, if you know the materia medica part of it, if you know the evolution part of it, if you know the pathophysiological part of it, then definitely you can use these remedies as a constitutional remedy also in your practice. Because when the layers of when the patient is covered with these types of layers of sarcode and nosode, none of your constitutional remedy is going to act well. And hence it is said, when well-selected remedies fail to act, to think of a nosode or a sarcode generally. So with this background, we go ahead, and I hope you must have really liked the last lecture. A lot of people have messaged me and appreciated. I really thank you from my heart for appreciating me this. The entire idea about my channel is to only promote homeopathy and the proper homeopathy, in the sense, whatever I have learned, I will not say what I am saying is only proper. Everybody is talking is proper homeopathy. But what reality I have faced, what I feel, my perception, my way of understanding, I am just sharing it, giving it out on the platform so that the next generation can take it and go ahead from there and build their own palace and build their own famous homeopathic practice, right? So let's go on a journey of understanding thyroidism part 2. So let me share this slide, and from there we go ahead. So thyroidism part 2. So today what we'll do is that we'll try to use Materia Medica and repertory to understand the finer aspects of thyroidism. You have understood the broader aspect, okay? When you think of thyroidism, developmental problem, you have understood metabolic, nervous, and vasomotor diseases. You've understood all those things, right? Now, finer aspects of thyroidism, let us try and understand, which you will actually see in your clinical practice, right? So what do we do is that what I did is first I went into ailments from, because any disease, like you understand disease in forms of ailments from, I always tell to my students that please understand remedies also in forms of ailments from positive modalities. What are the ailments? What are the diseases, the pathogenesis? So Boric, when you open, there is a chapter on ailments from. When you search in that, these were the rubrics I got for thyroidinum. Mixed edema, acromegaly, obesity, psoriasis, and cretinism. Sorry, cretinism. When you see all these diseases, these all are metabolic disorders. I'm not talking about what is metabolic disorders because we have explained that in a good length in the last video. And I hope anybody who's listening to this video, you should first listen to the part 1 of thyroidinum and then come here. So mixed edema, acromegaly, obesity is a very important part of thyroidinum. Psoriasis, we'll see. Psoriasis, it's one of the wonderful remedy to prescribe in psoriasis. Now, obesity and psoriasis, in today's generation, it is a lifestyle disorder also. What I mean by that, lifestyle disorder means it is a very common disease that you see in the practice. Obesity and psoriasis. And both of them are so difficult to treat. Of course, I am not here saying that obesity patient, you give thyroidinum and they will become lean, thin. Okay, no. I'm not saying that. If obesity is due to the metabolic disturbances, the metabolic disturbances will come down. And of course, she goes for a diet, walk, exercise, yoga. When she does that, it will help. You must have seen so many people who do vigorous exercise, yoga, diet, everything they do, but still the weight doesn't go down. Because the problem is not nutritional. The problem might be metabolic. Maybe their thyroidinum you can think of if the symptoms corroborate. Same as psoriasis. Psoriasis, autoimmune disorder, I know one of the difficult subject to touch. It is very difficult to treat psoriasis. But yes, thyroidinum is one of the drugs for that. Now we come at objective symptoms. Okay. There are two symptoms. One is objective and one is subjective. You know that, right? Subjective is what patient feel. Objective is what we observe. Now, every nosode or a sarcode, you talked about thuja, meadow, any remedy you talked about, carcinosin, natrium, any remedy you talk about, there are certain objective symptoms. Once I was having a discussion about how to detect anti-miasmatic remedies in practice, I was asking this question to one of my gurus, you know him very well, Dr. Dhanipkar, Dr. Gajanan Dhanipkar, sir. So what he told me is that, he said, Manish, what I do is that in my practice, if I want to look into anti-miasmatic remedies, to pinpoint it in a case, I look for the physical signs and the symptoms. He said every remedy like thuja, meadow, any remedy, carcinosin, they have got some physical signs and symptoms. Objective symptoms, that is rather they're called. The nails, the hair, the skin, texture, body, lot of things are there. So I said, from where do you get this, sir? From where do you understand this? He said, various books are there. One of the book he recommended me to study is Gunavante's, where you have general features of the remedies, Gunavante's book. So that was that. So I have taken that point from my teacher and it has helped me a lot in my practice. And so what I do is that now let's suppose we are studying thyroidinum. So we know what is the innate problem of thyroidinum, but we should also know the objective symptoms. Means the patient comes and sits in front of me. By looking at the patient, the hair, the skin, the eyes, the nose, nails, body posture, joints, smell, discharges, these are objective symptoms. So I should train, we as a homeopath should train our mind to catch these objective symptoms, not only in this remedy, but in entire remedy. Okay, so what are objective symptoms? So what I did is that I went in reverse. Actually, I have taken a lot of help of the software to study. This is how I generally study my remedies. In software, of course, there is a search index where you can limit a remedy in a rubric. Like you can open any chapter. I will show you how it can be done. You can open any chapter, you can limit the remedy there, and you will see only the remedy rubrics. So what I did is that I said, let me go and see the objective symptom. So Boric, we'll take small books first. Okay, Boric. Eyeballs protruding. Male testis, tuberculosis, undescended testicles in boys. So eyes, protruding eyes. If you see protruding eyes, you can think of thyroidinum. Undescended testes, especially in boys, when it has not descended. I will show you something. Let us go to boric first. Okay. I'll be doing this on and off. I'll be going to the repertory and Materia Medica part at the same time, just to show you exactly what I'm trying to show. So let's open boric. Let's read boric first. So when you read a remedy, first thing you should do is read the bolds and the italics. So when you see the bolds and the italic, mixed edema, cretinism, okay, understood. Here it comes. Let's read this. Delayed unions of fracture, okay. Delayed union of fractures, okay. In half grains, those twice considerable period said to be effective in undescended testes in boys. I recently, 1 year before, I had a case of a testicular cancer. Of course, he got operated and then came to me. He had many accessory troubles. Like there was a swelling in the legs, pain in the legs, which was not going. So the tumor, the cancer part, it was operated. But the other accessory symptoms which was there before the tumor, before the cancer itself, was not going. So this guy comes to me, and in his history, I found two things. Number one thing, I found that his testes never descended. He was a young boy, maybe 17, 18 years. He said, my one testis always remained up. This was number one thing. Second, I found past history of thyroid. I gave thyroidinum to this patient with a wonderful recovery of accessory symptoms. His swelling in the legs, pain in the legs, his legs used to become cold, hot, all those symptoms went away. Now, undescended testes in the boys. You can get this in a history. Like maybe patient is adult. You might get in the past history that, yeah, in the childhood, for a long time, the testes had not come down. That is why it is important to take past histories of the disease. Now, when testis has not come down, it has not descended. What does it mean? Of course, you know what this means. If you have listened to my first lecture, this is developmental problem. In the developmental cycle, in the childhood period, when the development is happening, you remember the case of the vocal cord that I said. You remember the case of that lady, 18 years, she got married and she used to get convulsions after coition. So the functional development, the organ development has not happened. It gets arrested. It was developing and suddenly it got arrested. That is thyroidinum, basically. Right? Let's come back. I'll come back to boric again because I will be taking a lot of help from the boric Materia Medica. Oh, just a minute. There's a rubric in FATAC, and this is very interesting rubric. Symmetrical. There are only 5 remedies. There are only 5 remedies. Recently, I have a video of that case actually, a case of psoriasis. But of course, I can't show you right now here because this is an open platform and I have not taken any permission from the patient to expose it, right? She's a lady around 50 years of age, 50 plus years of age. She was having psoriasis. So of course, she was taking treatment from many places. Yeah, I'm really sorry. I lost this slide. There's some network glitch. Yeah, I was talking about this case. Just I have a case. A lady came to me, 50 years of age. Of course, I can't show you the video right now because of privacy issue. So this lady is around 50 plus age. She's having psoriasis for a long time, and many medicines were given actually. And she came to the OPD. So when I was observing her, of course, all the features of psoriasis were there. Now scaling, itching, all those things, desquamation, everything was there. After observing her quietly, I observed one thing that all the patches that she had were all symmetrical. Sides affection is also one of a very characteristic symptoms. Like, people come right-sided, one-sided, right? Left to right, right to left, above downwards, downwards above. So these are very important symptoms. So what I observed is that she has symmetrical things. Means if the lesion is on this palm, same lesion is on the exactly same palm. If it is on the, this side, left side, right side, then left side, symmetrical. So these symptoms are called symmetrical when you have lesions both side of the body at the same location. Only side is different. So there are 5 remedies in Pata. Looking at that, and then I asked her about thyroid. She had a thyroid disease also earlier. I gave thyroidinum on just that 2 indication, symmetrical and past history of thyroid. And to my surprise, she came after 1 month follow-up. Generally, I called 15 days, but she came after 1 month. Her almost 70 to 80% lesions went off. And all the accessory symptoms which were there, like pain, fever used to come, all those symptom, minor complaints which were there, that also went off. But around 70 to 80%, her psoriasis is completely better. Completely better. So I have right now kept her only on SL. And I'm observing. It's been almost now, I think, 4 or 5 months. It's been almost 4 or 5 months. So I had 2 or 3 follow-ups after that. And lesion is slowly subsiding. So I'm doing nothing right now. I'm just waiting new symptom to come, or maybe flaring up of the symptom, and I'll repeat whatever is required. That's the important. That is the importance of observation. So thyroidinum, it's very important. Symmetrical locations, whether it is psoriasis, eczema, itching, tumor, anything which is there, symmetrical. Another very important objective symptom is cold, icy hands. I have seen this in my practice that a lot of females who come, they will tell you, I just remembered one case right now. I have not given her thyroidinum. I gave some other remedy. But this lady came to me and she has multiple complaints: acidity, bloating, cervical spondylitis, so many things are there. So all things are better. In the last follow-up only, I just remember because it was just last Monday I saw her. This lady says that my this hands, doctor, this much. It always remains cold. I said, really? And this symptom she had not shared to me before, anytime. I touched her. It was actually cold. She says, whatever I do now, my body is all normal, but this part is cold. So of course I considered there are other remedies also. In thyroidinum, it is very important. Like we have other remedies of carboveg, we have silica. But now you understand, right? Why cold icy hands in thyroidinum? Because vasomotor constriction. It is one of the remedies for vasomotor constriction. That is the reason. So this is again one of a very important cardinal objective symptom. Hands, veins swelled. You'll see in Materia Medica when you're reading. We'll go and read Boger also here. Hands, the veins in the hand. Generally see the veins in the hand you can see. A lot of people, like you can't see mine. But there are some people whom you can see it is very prominent. That is also normal. But it is swelled. The patient will tell you, doctor, earlier it was normal, but now you can see the veins, not only in the hands, palm, but also here, arms. So entire arms, you will see it has swelled. What does that indicate? Again, vasomotor disturbance. Problem with circulation, especially periphery. See this arms vein. So this is arm, right? Arms and forearm, whatever it is. So you'll see veins in the arms. Prominent veins are seen in the arms. This is such a beautiful, maybe a keynote objective symptoms. And all this happens because of vasomotor disturbances, vasoconstriction or vasodilatation. Another important mental feature is foolish, childish. Now, of course, we know cretinism, acromegaly, those metabolic disturbances are there. And whenever these metabolic developmental issues are there in childhood, dwarfism like foolishness, definitely you'll find it. So the remedies like Baraita carbonicum, Bufo, and other remedies which are childish and foolish. Thyroidinum as a child can also be childish in their appearances. Normally, whenever we are studying any remedy, we are very excited to know the mind symptoms. So I started studying mind symptoms and I said, let me see if what are the mental symptoms. Can I prescribe thyroidinum through mental symptoms? And to my surprise, this is what I got. This is in Fatak repertory, and you'll find the same thing in the Materia Medica also. Persecution ideas that they are persecuted. Remedies like hyoscyamus, Drosera. These are the remedies. Plumbum. So somebody is there to kill them, persecute them. Suspiciousness. So whenever you're thinking of hyoscyamus, Drosera, plumbum, those remedies, anacardium, where the ideas of persecution is there, we're very suspicious. Thyroidinum also belongs there. That is, this is one of the very important mental symptoms. There are very few mental symptoms of thyroidinum. This is one of them. Thinking of it aggravates, like oxalic acid, some other remedies, whenever they think. Now, I don't know how to understand this symptom, right? I really don't know, but that's very important keynote mental symptom. Weeps, undresses. I have no idea about this symptom. Maybe I will wait if I can get the symptom in my practice. So whenever she's undressing, she's weeping. In fact, what you should do is that you should put in your search index undressing. You'll find many rubrics of undressing, like teaching undressing when, okay, you have natrum self. So similarly, weeping when undressing. That's amazing, right? This is peculiar, rare, strange. So peculiar it is. If you get these kinds of symptoms, definitely you can think of thyroidinum. See, the idea of studying these remedies like this, I always study remedies in this fashion. You know why? It's not to remember the drugs. Maybe tomorrow, if you ask me what is a mental symptom of thyroidism, I might forget it. I might forget. I don't know. But the rubrics that I have seen, the symptoms that I have seen, the symptoms revolve in my subconscious mind. So now, when a patient comes and I find the symptom, definitely I'll go and search. And that's how it helps me in my practice. That is why it is important to keep studying Materia Medica. Don't try to remember Materia Medica. Oh, I want to remember. Oh, I forgot. What was the symptom I studied last night? No, you don't need to remember that. You just keep on studying, understanding, and leave it. Everything gets stored in your subconscious. And when the right time comes, the symptoms come out. Now, skin. As we know, it is a very good remedy for psoriasis. Definitely. In Ghosh, it is said, Ghosh, he says that if there is past history of allergies, bronchitis, asthma is also allergy or skin allergies, asthma is there or skin symptoms are there, definitely one of the remedies you can think of thyroidinum means eczema, asthma, all allergic manifestation. So let us understand how is the skin of thyroidinum. Skin anhidrosis, skin chilblains, lupus erythematosum, edema, pityriasis, fungal infection, psoriasis, flabbiness, ichthyosis, lepra, rupia, scleroderma. Now, when you look at this, you say, wow, what are they talking about? They're talking about the clinical indications. Now, I'm not going to talk everything about what is ichthyosis, what is anhidrosis. These are old terminologies. Maybe these terminologies are not used in medical science right now. But few of them are used, like pityriasis, fungal infection, scleroderma. This is the sphere of action. So go and Google it and find out what is the meaning of these lepra. How does lepra skin look like? Ichthyosis, how does it look like? And hydrosis, how does it look like? It is said angioneurotic edemas. Thyroidinum is also one of the remedy for angioneurotic edemas. So you'll find edema, swelling, flabbiness. You'll get ladies now who says, my body is swollen, doctor. My body is swollen. Whole body is swollen. Whole body is swollen. They feel that sensation of swelling. So edema, flabbiness. And then I found out one terminology, brownie swelling. I was very interested about it. I said, what does it mean? In many places, in thyroidinum, it is written brownie swelling. So these are again old terminologies. Of course, it might not be used here. And of course, I don't know if allopaths use this, but even homeopaths don't know this because we don't talk about these symptoms. So what is author trying to say? What is the meaning of brownie swelling? So from the literature, what I got is brownie swelling is also known as brownie edema. Refers to all a type of swelling that is characterized by. So it is brownie swelling means it is a type of swelling. The characteristic symptoms are firmness and inability to pit when pressed. So basically non-pitting edema. We saw just in the last slide edema. So body is swollen. There could be edema, non-pitting edema, thyroidism. It's a condition where fluid in the tissue becomes thickened, dense due to increased connective tissue or tissue cells, often accompanied by changes in skin pigmentation, such as brownish discoloration. So what you'll find is that there could be edema in some location like face, chest, legs, and along with edema, you'll have non-pitting edema. It's not pitting. Number two. Second, slowly, the skin becomes darker. Brownish means it is becoming darker and darker. If somebody is fair, it might look brown. If somebody is darker skin, it might look black also. So becomes darker. Skin slowly becomes darker and darker. So remember, edema, non-pitting edema, and outer skin is becoming scaly and darker. So that's how it is. So when you put in search brownie swelling, so many places you will find out. So many places. So please go and read about this. You can get more ideas about it. Okay. Now, what are important symptoms? What other important symptoms are there? If I say, if I want some general symptoms to remember, what are those? Dryness. We'll go to the repertory study now and I'll show you how many places dryness is there. Dry. It's a dry remedy. Skin is dry, eyes is dry, hairs are dry. A lot of dryness is there. Craving for sweets like argentum nitricum, lycopodium. Intense craving for sweets. They love sweets generally. Very important symptom. Congestion downwards. As I said about the direction, the lesions are symmetrical. But there is congestion which goes downwards. What does it mean? Opposite is glonine. In glonine, what happens? Glonine, belladonna. Congestion is there and there is surge of blood. There is flushes of heat goes up. Palpitation, throbbing is temples, throat, neck, face. Here, the flushes or the congestion goes downwards. I will show you in some other symptoms. How does it matter? So symptoms going downwards, basically. Yeah, this is a rubric. Leg, blood rushes to legs. Oh, it is such a beautiful symptom, don't you think so? We always hear that flushes. When we say flushes of heat, we always think it is going upward. Neck, like we have got ferrum metallica, ferrum series. We have got glonine, lacasis, belladonna, sanguinaria. These remedies, even asteria rubens, all these remedy flushes goes up. But there is also a kind of rubric. Now, when I was reading this remedy, then I got to know that this symptom can also occur. Remember, your eyes will only see what your mind knows. So now when you know your mind knows, maybe you have forgotten thyroidinum, but you know the rubric. So what you'll do is that, simple is, you go and search in the repertory. So legs, blood rushes to leg. Very nice symptom. Another symptom is pelvis around to thighs. Listen, just look at the symptom. I will show you in repertory many places. Pelvis around thighs, pain, congestion, discomfort. From pelvis it goes to thighs. So now you're understanding what's happening. Whether it is flushing of the blood, whether it is pain, the direction of symptom is downward. You'll have so many remedies. There's a rubric, direction of symptoms, upward, ascending, descending. You have it, right? Diagonal. But here it is very specific. There is discomfort in pelvis. This goes to the thighs. Discomfort in pelvis goes to the thighs. Itching with jaundice. Many a times, it is also one of the good remedy for jaundice when that period when itching is too much. Another symptom, very important. Now, of course, I'll show you boric, Materia Medica. You can see in boric, if you have boric, you can open right now. You'll see tachycardia palpitation in bold, bold. It is written in bold, like mixed edema, undescended testis, tachycardia. So you might, I'm giving just example. I have got one patient of adenomyosis. Okay. Uterus, there is this adenomyosis. It was a very bad condition. She was admitted in KM hospital. They said, we cannot do anything, just give painkillers. And she was in tremendous pain. She came to me. I started treating her gradually, with some changes of remedy, slowly. What happened is that patient got better. Her adenomyosis reduced, pain swelling went out. But she had not become completely better. And now, after a course of 1 or 2 months of maybe 2 months or 3 months, as she was getting better, suddenly she started developing palpitation. And now the symptoms she used to tell me earlier, but it was not in intense degree. What she says now, suddenly my heart starts beating. Suddenly my heart starts beating. So they did all the tests, 2D, echo, ECG, everything. Everything is normal. Now I'm thinking, what is happening here? She has thyroid also. She was on thyroid medications for a long time, and I was planning to reduce. But when this tachycardia came and I started studying again, then I saw that palpitation tachycardia is one of the very crucial symptom of thyroidinum itself. Especially when, like in this case, which I'm sharing with you, I thought it is a reflex from the uterus to the thyroid. But this lady was having already thyroid, and she was having her sisters having, mother having, there was past history, family history. So I started giving her thyroidinum. And after thyroidinum, I gave it in C potency. Then later I gave it in 6X. Her palpitation is now slowly coming down. And of course, not just palpitation, but all the other symptoms are also coming down. This is the beauty of understanding sarcodes and nosodes in this fashion. Because your constitution remedy will do its good, whatever it has to do, right? But there can be a time when you will be stuck. And these minor symptoms which popping up here and there, sometimes it gets difficult to understand. But yes, if you know your nosodal or sarcodal remedies, your anti-miasmatic remedies, this is how you can prescribe anti-miasmatic remedies with pure surety, right? Now what we'll do is that we are at the end of our topic. The purpose of sharing this, there are so many things that we can share. The purpose of sharing this is to motivate you so that you go and read the Materia Medica of these sarcodes and nosodes. Now I'll share you how I read whenever I want to read any sarcodal remedies, nosodal remedies. How do I increase my knowledge? Because again, right, eyes can see only what mind knows. If I don't, now I know symmetrical. There's a symptom like symmetrical. Now I know, okay, there is something like pelvis to thighs. Okay, there is something like blood rushes to the legs. I know this, right? Dryness is there. Oh, brownie swelling. Now what is brownie swelling? When I know all these things, then only I'll be able to observe in my patient. Isn't it? Right. So now I'll share you how do I study. So what I do is that I'll take you to my repertory. I take a lot of help. I take a lot of help from my reference work. So this is my reference work. So if you see here, oh, why is it not happening? Just a minute, just a minute. Just give me 2 minutes. I think I have to close this and then again start it. Okay. Just give me 2 minutes. Till then, if you have time, you can just open Boric and just see the bold and the italics of thyroidism. Yeah, now it's there. So loading repertory, share. go here, I put thyroidinum. What I do is that I put thyroidinum. Now, this will limit my repertoire to show me only thyroid. So I will take a very simple book. I will take Boger Synoptic Key. And let us go chapter wise chapter and try to understand and learn the symptoms of thyroid. Let us open Bore. Sorry, mind. So when you go in mind in Boger, these are the two rubrics. Persecuted as if, of course, anger, there are 34 remedies. I'm just talking about smaller rubric which has got smaller less remedies, and thyroidinum is there. So feeling of persecution, we already studied. So feeling of persecution. So I'll show you only the important ones. Okay, hair falling, external head when you go, hair falling. Now, falling of hair is a very important component of thyroidinum. A lot of patients with hair fall, you can control it with thyroidinum. And thyroid, whenever thyroid problem is there, you know that hair fall is one of the symptoms, right? So let's go to, now see this. Nose dry, lips dry. Okay. Shall we go to the skin? Okay, we'll come back to other skin. So you feel dry, you see dryness many places. Now here in skin, let's go to the skin. Skin briny. What is briny skin? What is briny skin? Let me open briny. Let me show you what is briny. Let me show you briny. What is briny? Okay. This is how I study because these are the terms. No? These are old literatures, English language. Basically, you don't find it here. Briny skin refers to that has fine powdery bran-like scaling or shedding. You know what is bran? You know what is bran? The term brany describes texture of scale resembling bran. What is bran? The outer covering of the grains. If you have seen the grains like wheat, if you see wheat, the outer covering is there. That is bran. It is called braining. It is often associated with certain skin condition like pityriasis vesicular or pityriasis alba, where scale is characteristic. You will see it's a fungal infection basically where you see scalings happening. You can see this, right? Branding skin desquamation. Let us select. You'll see like this. The scaling is happening. In the hands, it is happening. Okay. So just for the information. So let's go back. Eruption psoriasis, we know that. Eruption pustulating, general. Hairy, skin hairy. And this is interesting. Skin hairy. If you open this, there are two more remedies. Medorinum and Medorinum and Thuja. Medo, Thuja, Thyroidinum. These are two remedies where skin hairy. Arms hairy, Medorinum. Unusual hairy growths in the ear, Thuja. And general, of course, Thyroidinum is the another very close remedy. So hairy remedy. This is just looking at this. Also, you can think of thyroidinum. And why I'm sharing this because many times where psychosis, as a psychotic remedy that you're giving, many times I think thyroidinum is just in the background and we just miss it. We just miss it. Scurfy, scaling, and mealy. What is mealy? Let us understand this. Let me show you what is mealy. I hope you can see my skin. I'm just showing you the skin of mealy. What is the meaning of mealy skin? Which has tiny white cyst on the skin. I don't know if this is shared or not. I'll share it again. Mealy. Tiny white cyst on skin, description of skin texture, pale, powdery appearance. Okay. This. These spots that come up, you can see the spots, mealy spots, it is said. Yeah, this is good one. This is called mealy spot. So spot, or scales come, and then it becomes darker and darker. This is thyroidinum. Let's get to other parts. Now, a few more things I want to show you. Coughing aggravates. Okay, like ignitia. Again, you see larynx dry, nose dry, lips dry, even skin is also dry. But more than dryness, along with dryness, there is scaling. Okay, okay. Now, when you open heart, see so many symptoms are there. So many symptoms are there. Heart circulation, arms to left, to axilla, blood rushes down. Again, you see blood sepsis rushes downward. So remember this, I think there are very few remedies where blood rushes downward. Majorly, we see all the blood arterial ones go upwards. So there can be case, you have a case of sepsis where the feeling is that blood is rushing downwards. Clutching, ears, goiter heart. We have alcoholic heart. We have, heart problem from so many other reasons, but goiter heart. So a lady comes who has goiter and then has heart trouble. Hypertrophy, heart hypertrophy. So heart affection, like we see in psychotic cases, rheumatic cases, heart is very important affection. So heart affection. So if thyroid symptoms are in the background, or past history and family history of thyroid is in the background, and heart is affected, palpitation is there, tachycardia is there, hypertrophy is there. You think of thyroidinum. Patient gets breathless. You think of thyroidinum. Okay. Hypertrophy. I'll show you something in Boger what is written. Something very nice he has written. Extremities. Limbs rushes to. Blood rushes to limbs. Again, the downward motion. We already did skin. Okay, okay. This one thing I want to show you. Faints. Okay. Chilly. Thyroidinum is very chilly remedy. General, it is dryness. I told you these are general symptoms. Dryness. Musty and moldy. Weak and fever. Wind draft blowing on the part to hole. So very chilly remedy, dry remedy. Yeah. Conditions. The modalities are very important part of every remedy. Lying on abdomen aggravates, thinking of complaints aggravates. Lying on abdomen, again you see meadorrhinum. So in many places, when I was studying thyroidinum, I understood that at many places thyroidinum comes very close to meadow, like uh, lying on abdomen symptom, skin hairy, meadow, uterine trouble, meadow, thyroid is also a part of it. So maybe you are giving meadorrhinum for a long time. Thyroidinum could be the remedy for the patient. Thinking of it aggravates. Now let's go to boric. Boric is very interesting. Of course, ailments from we have already done. Okay, memory part. What do I want to show you? To show you something. Extremities maybe. Huh. This I want to show you. Joint inflammation, thighs and leg swelling. No, I want to show you something. Hmm. Fibroadenoma. It's a good remedy for fibroadenoma. I wanted to show you something. Hip. Let me search. Pelvis. Hip. Oh, sorry. Pelvis to thigh. Yeah. Pelvis to thighs. Achha, it is there in Google. Pelvis to thigh. Oh, I showed you this, right? Yeah. So pain in the pelvis, it goes to the thigh region. Okay, I've shown you. I think I've done everything now. Pelvis to thigh around. Thyroidinum and viburnum. This pelvis to thigh is a very important symptom you will get in dysmenorrhea many. I have a lady, I have not given the remedy now. I'm today only I'm going to give this. She's a young girl, she had come to me. So I had given this severe dysmenorrhea she has, severe. So she has a symptom that pain in the pelvic region, it goes to the thighs. I gave some other remedy that time, but today she's going to come. I just have a case maybe now. I'm going to confirm that symptom. Maybe vasomotor things and other aspects, if vomiting and other things are there, which is there in her case. So now I'm thinking of giving thyroidinum in that case because she's suffering from dysmenorrhea. She's a young girl, 21 years of age, suffering from dysmenorrhea, very bad. Another remedy is viburnum, if you see. Viburnum is also a very good remedy for dysmenorrhea if symptoms corroborate. So thank you very much, guys. This was a short introduction, and I finished thyroidinum here. Of course, it is not finished. There are so many different aspects of it which can be explored. And through the clinical practice, when we give it in a case, we get a result and we share it with others. That's how we can come together and increase this knowledge. Understanding of nosodes and sarcodes in a complete different fashion, not just keeping it empirical, but knowing the drugs as we know the drugs, polycrest drugs. When you start knowing these drugs as a polycrest drug, you know their objective symptoms, subjective symptoms, it becomes very easy for you to spot it. You don't have to just depend and empirically things will happen. No, no. Homeopathy is very predictive. If you can really be very sure, many times in our prescription we are unsure. Even especially anti-miasmatic remedies, a lot of people are unsure. De do yaar, koi baat nahi. Just give. Back, you know, so much confusion is there. There is no confusion. If you study the drugs properly, remember this last thing I'm going to say and end it off. Homeopathic practice, the center core principle is individualization. Individualization. Whether you give a mother tincture, whether you give a biochemic remedy, whether you give bacterial remedy, you give constitutional remedy, you give any remedy, you will have to individualize the remedy and then give. Other than that, it will not help. If you were not able to individualize, then you will not be able to help the patient. Remember this carefully. I'm done with it. And definitely, if you like the lecture, please do comment because when you comment, a lot of motivation comes to make more videos like this. I hope the talk that I did this, part 1 and part 2 of thyroidinum, it will help you in your practice. That is the sole purpose of making these videos so that you get results, you get motivated to do good homeopathy. More results come, more homeopaths grow, and they feel confident in their practice. Then only homeopathy will grow and homeopaths will. Thank you very much. Namaskar.